There have been several reports that there may need to be an increase in tax or a tax hike to pay for the rollout of Covid-19 vaccines. The Health Department is said to procure vaccine doses for 2/3 of our population, and then to distribute them and inject them should cost around 20 billion rand. Other estimates are actually less than that. Professor Alex van den Heever is an expert on healthcare and social systems at the Wits School of Governance. Professor, good afternoon to you. I mean, 20 billion rand sounds like a lot of money, but it comes from a budget of around 1.5 trillion rand. Are we going to need a new tax?
I would be very surprised if we did. I mean, firstly, what I find a little bit confusing is the 20 billion rand aspect of the proposal, because if you do a costing just of the vaccine itself, it would probably come to sort of roughly 7.4 to maybe 10 billion rand in total cost, including supply chain costs. And if you add in some aspects of distribution into that, it'll take it up a bit. But distribution costs in many cases are part of fixed overheads in the health system already, and it's unclear whether or not you'd actually have to spend additional funds on them. So I do not know where the extra 10 billion rand is coming from in that proposal.
Either way, I mean, if I remember correctly, an increase of 1% in VAT, when VAT went from 14 to 15%, I think it was 2.5, 3 years ago, it ended up netting around 20 billion rand. I mean, that would be a fair tax, but it wouldn't be very progressive.
No, if you introduced a VAT, would actually be very problematic. It's a very regressive tax the poor more than the rich. But when you don't introduce taxes for very specific programs, so I'm a bit confused that anybody's making a proposal to increase taxes for the vaccine program. You would do it as part of a general strategy to finance the deficit at a particular level. So I would not see it even being considered in relation to the vaccine strategy itself, which is a relatively small portion of the total budget, particularly if you spread it over 2 financial years. Remember, we're still completing the 2020-21 financial year, and then we will be incurring the lion's share of the vaccine program in 2021-22. So as far as I understand, there's already about 2.5 billion rand in the current budget for the vaccine program, and there will be a residual amount of probably about 8 billion rand in the next financial year. I don't envisage any tax increase to finance that.
I mean, there are all sorts of other options, aren't there? I mean, I think it was the IMF is offering us money at around 1% interest a year. I mean, $1 billion would be 15 billion rand. I mean, that's almost free money.
Yeah, if we had to borrow it, we could. There are already proposals for the private sector to finance in one way or another a substantial portion of the vaccine program. But these strategies themselves are being affected by government wanting to be the sole procurer and negotiator of price of the vaccines, which actually limits the ability of other parties to get involved in providing funding. But from my discussions with members of the corporate sector as well as medical schemes, is if you had to combine them, government would end up only having to fund a very small part of the overall vaccine program and would not require any tax increase whatsoever. So it really depends on whether or not government is doing its job to properly source finances for this program. There's huge public interest in making sure it happens.
The National Health Minister, Dr. William Kiese, said just an hour and a half ago here on Newzroom Afrika that essentially government would be the only procurer. He said that provinces could not, and he was making a point. He was asked a question about the Western Cape. I mean, are you saying that that's the wrong approach? I mean, government's argument, as I understand it, is that that will make it cheaper in the longer run if they're the only procurer in South Africa.
I don't think it would. At the moment, most people are concerned about being able to access vaccines rather than whether or not it's a few percentage points higher or lower. The problem with the single procurement approach that government has been attempting to pursue is that if they fail to actually enter into bilateral agreements timeously, everybody is compromised. Whereas in fact, we have the capability in South Africa to procure from a number of different sources, including the large mining houses, major employers in South Africa, medical schemes, the private health system itself with facilities, pharmacies, etc. We've got huge distribution structures in place. If we were basically able to decentralize the procurement process, it probably would happen a lot faster. But I'm also not entirely sure how government aims to stop people from procuring vaccines. it isn't entirely clear what law they would use.
Well, I was going to say, I mean, I know of at least two pharmaceutical chains. I mean, they're both big name brands who've said they would offer vaccines. I mean, you would go into the pharmacy and ask for one and pay for it. I would imagine under the law, someone would actually have a right to a vaccine were it available. I mean, you wouldn't be able to stop them from paying for it.
Well, government would have to have a very good case, because for blocking a sort of a rollout because essentially you're obstructing somebody's right to healthcare. And unless you're showing that somebody else's right is severely compromised, and therefore it requires a single purchasing approach, it probably would fail a legal challenge. It may fail a legal challenge. In the case of the Newzroom program in 2002, the Constitutional Court decided that government couldn't use an argument that it couldn't give access to everybody equally at that moment in time they rolled out as a basis for obstructing a rollout program. They just told them, get on with it and sort out the equity issues as you move forward, just move it. And I think that that's kind of where a lot of people are at the moment. People just want to see stuff moving. And the problem is that if you have one gatekeeper and they don't do their job properly, then we have a serious problem. And that's where the benefit of a more decentralized approach comes in.
I mean, it seems to me at this stage, I mean, this is exactly the kind of issue that weakens the democratic government, because there's going to be huge frustration and huge anger among people to get a vaccine. Everyone wants to see the first person in our country being vaccinated. And yet there's a lot of sort of cloud, a lot of smoke, but we don't actually know what's going on. Now, I mean, I go with government so far in which they say that, for example, the negotiations can't be held in public. That may or may not be true. But the longer that we fall behind other countries, the more frustration and anger I would think there's going to be.
Yeah, I mean, a single procure approach would be a valid one if you were doing your job efficiently and timeously. So I think that, yes, there's going to be huge frustration building up, particularly where we have capabilities to roll out vaccines very, very quickly, and not just to special elites or to privileged groups in society, but to large numbers of people in society, and even to substantially cross-subsidize. But basically, people want to have some control over the access to vaccines and its rollout. So as I said, large mining houses, why would you obstruct them? If they were actually providing vaccines to not only their employees, but also to the communities that their employees belong to, many mining houses would freely go for it. They did it in the case of HIV and AIDS programs in the past, particularly where government itself wasn't rolling out an HIV program. They were the ones who kind of got it going. And similarly, the Western Cape in the past, the HIV/AIDS programs rolled out first in the Western Cape, not in the rest of South Africa. So this is what happens when the central government doesn't do its job. There is frustration for other parties to just move forward. We could do it better if national government was actually doing its job. But the question is, what do we do when they fail?
There's so many things to all of this. I mean, I think there must be a concern, not so much about equity, but about arguments. I mean, everyone in South Africa, for various reasons, likes to go off to court. I mean, it would be the worst thing in the world if we used this as an opportunity to fight rather than to vaccinate our population.
Yeah, what you want to do is just, everybody that gets vaccinated is progress toward herd immunity. So the faster it goes to somebody, anybody, you definitely want to have frontline healthcare workers prioritized and vaccinated as soon as possible. There should be absolutely no obstruction in that happening. But everybody that gets a vaccine is a step toward herd immunity. And therefore, any delay in any rollout or any part of it will be a problem for South Africa. So for us to sit and wait for 3 to 4 months while government dithers around its bilateral contracting for who knows what reason, but when we could actually be entering into contracts. And as I say again, there are many entities in South Africa who are extremely familiar with entering into these kind of contracts and being able to administer things like vaccines and medicines on a large scale. South Africa does have that capability. The public sector doesn't necessarily have it on its own. It will have to do it on a sort of large scale with the private sector. But we basically have to let the people who can do this get on with it, and to cooperate and coordinate with government. But the strategy involves, if you were looking at that, it's not a centralized strategy. It's one in which you're coordinating and enabling rather than becoming a single gatekeeper. And the question is, what is our most appropriate strategy in context? And I'm not sure that just sitting there and saying, oh, well, government must do everything, is the best way forward, because it holds so many people back that could just get on with it.
Professor Alex van den Heerfer, thank you, from the Social Security Systems Administration and Management Studies at the Wits School of Governance.